Hi, my name is Dr. Miller. I'm a dentist, and I've been asked to give you an idea of what a typical day is for me. I don't know if there is such thing as a typical day, but we start about 7:45 every morning, and we will all meet in my office, my staff. I've got 2 people that work at the front desk. I've got 2 hygienists and 2 dental assistants. I have a small private practice in Pensacola, Florida, and we will meet every morning to discuss the patients that we're going to see that day and what procedures we're going to do. That gives us a great time to meet and discuss some of the questions we may have that involve medical history and everything from difficulties or challenges that we might be facing on the procedures. After our meeting, we'll typically start with our first patients around 8:30, so that gives us some time to have a no-rush discussion and set up for what we're going to do that day. What is a typical day? A typical day is anything from an extraction to a root canal to doing a full mouth restoration, which could include root canals, crowns and bridge work, and veneer work. We do a lot of restorative work or cosmetic dentistry that has become something that people have asked for more and more over the last few years. People want to look good and they want to feel good, and sometimes we will have people that want both. When I first started practicing, the majority of my work was focused around doing restorative work to repair people's teeth so that they felt good. People would have a toothache, a broken tooth, and they would give us a shout. We typically have the patient come in. We will either do an emergency exam if a patient is in pain and they've called us that day, and that entails finding out what the problem is, typically asking some questions, getting some answers about what type of discomfort they're having. It can range anywhere from a toothache to sensitivity to hot, cold. Can be various things that can bring someone in for a toothache. And then we will go ahead, take an x-ray, and diagnose what the problem is. Now that's considered an emergency appointment. It's something that wasn't probably on the schedule or has only been on the schedule for about a day or two, typically a day. The other type of appointments we have are typically treatment planned in advance. We'll have a patient that comes in, they've decided that they want us to take a look at their whole mouth, and we will set their first appointment up as a comprehensive new patient exam. That's an opportunity for us to spend more time taking a full series of x-rays. That's x-rays of every tooth in their mouth, spending time doing a comprehensive exam where we look at everything from the tooth itself to the gum tissues to the bone in the mouth, how the TMJ, which is the temporomandibular joint, how that functions, and how everything's working together. And we will come up with a plan that's going to allow them to have not only a healthy mouth and a plan to keep it healthy, but if there's any needs that need to be addressed, both for a restorative purpose, if they've got broken teeth, decayed teeth, missing teeth, but also we can discuss cosmetic options. Some of the things that we have to be aware of and be trained for are dealing with people's health history, unexpected anxiety, and any sort of health issues that could be triggered or elevated by stress. In the dental office, we've got procedures that a number of people feel stress with. Even before they come in the office, they can be upset or nervous about what we might do. More times than not, when we get them here, we have a chance to give them a peace of mind and walk them through procedures so that they're fine. Occasionally, depending on people's stress level, experience, we have to spend more time managing their stress. In order to become a dentist, you have to earn a degree in dentistry, either a DDS or a DMD. The two are used interchangeably and mean basically the same thing, that you are qualified and you have taken the curriculum to practice dentistry. It begins way back before maybe even you know it does by going to undergraduate school. As far as what you should want to focus on if you are thinking about becoming a dentist, it's going to be a Bachelor of Science. Although it's not required that you get your undergraduate degree in the science department, you can, it's encouraged to focus on the sciences. You could be a graduate with microbiology as your major, or you may get a degree in the sciences in organic chemistry or any of the chemistries. But something with a heavy influence on a science background is really going to give you a good head start in pursuing a degree in the dental field. So after getting your undergraduate degree, you would need to take a pre-dental exam, which is called the DAT, the Dental Admissions Test. Once you have completed your DAT and you've completed your undergraduate degree, then you are technically in a position to be accepted to dental school. While you do not actually have to have an undergraduate degree in the sciences, it helps greatly. I did not have a degree in a Bachelor of Science. I had a Bachelor of Arts, but that was about 17 years ago, and I can assure you that the competitive nature of getting into dental school has changed. And because of that, while it still isn't required that you have a Bachelor of Science, it's going to give you a real advantage if you spend time in your 4 years before applying to dental school getting a degree in the sciences. It'll not only prepare you better for admissions, but it'll prepare you better once you get into dental school. Dental school itself, to get a degree as a general dentist, is a 4-year program. Like other medical fields, there are specialties that you can also focus on after you get your 4-year degree. You can focus on something called endodontics, which is going to be the specialization in treating root canals. You can become a pedodontist, which is the practice of specializing in treating just children. The specialty of prosthodontics would relate to high-end cases of cosmetic work that typically involve challenging situations, whether crowding of teeth is an issue, limited jaw size, or any number of things that a general dentist may not feel comfortable addressing. There's also the specialty of oral surgery. That requires the most additional training of any of the specialties. Most of the specialties will require about a 2-year program. The oral surgery program is typically 4 to 5 years. And then there's also the specialty of orthodontics, which is going to involve straightening of teeth, or if you've seen children or adults even with braces, that's because they've been treated by an orthodontist. In any case, there are options for you to consider once you're in dental school as to what direction you want to go. I was happy spending 4 years to learn general dentistry, which technically allows you to treat any one of those specialties. The difference being, if you decide to become a specialist, you'll get advanced training in just one field, and that is the only field that you're allowed to practice. A general dentist can practice in any of those fields, depending on his comfort level. Should you decide that general dentistry is where you want to finish, after your 4th year, you can apply to a postgraduate program known as a general practice residency, or a GPR. There's different types available, and it offers you an opportunity to do dentistry, to practice dentistry in an environment that's more like a hospital, and sometimes is in a hospital, without having to make the full transition into a private practice. There is definitely a transition that is made between finishing dental school and then going out into the real world and practicing dentistry. If you don't have the benefit of taking a general practice residency, I truly think that you're not giving yourself the best opportunity to hit the ground running when you do go into private practice. It's highly encouraged but not required. When I was thinking about what I wanted to do for a living, it wasn't that I had a lifelong dream of being a dentist. It's not to say that there aren't some people that do have that dream. I didn't. I was thinking about a career that I could get into that I thought would be a good extension of what I like to do and who I was. I knew I enjoyed talking to people and communicating. I knew I was comfortable in a social atmosphere, and that I had a knack or a feel of how to calm people and how to make people feel relaxed. I also knew that I wanted to shoot or strive for a certain type of lifestyle that would give me the opportunity to have some flexibility of a work schedule, and also the income potential that would allow me to do things that I thought would be important, which would include traveling, time off, time with the family, and maybe being able to enjoy some of the nicer things in life. I enjoy eating out. I like to live in a nice home in a nice part of town, things that a lot of us think make up the American dream. Dentistry allowed me to do all of those things. The actual practice of dentistry itself is also enjoyable. It's something where you get to use your brain, you get to use creative skills, and there's a touch of art and there's a touch of analytical. You don't need to be a brain to be a dentist, but you need to be a person who's conscientious, caring, and kind. If you are those things, if you practice those things, if you talk to people and you give people your true spirit and peace of mind, you'll find that you will win people over and they will think that you're the best dentist in the world. And that's really how you want to feel. There's bad things in dentistry too, just like any job. I think there are things that you can't expect until you get into practice and live through them. And some of those would include the worry or the stress of malpractice. I'd have to say that for a long time, that was one of my major concerns. How am I going to finish dental school with training just enough to be a dentist and go out and then become an expert? And the answer is you're not, and you can't. It takes time. So the importance of treating people well becomes even more paramount, so that if there is an error, if there is an oversight, you have an ability to tell that patient that the plan didn't go exactly as I hoped it would or thought it would. But you have to also want and give the patient the ability to make it right at your cost. And that will happen, and that may continue to happen. But the good news is, as you practice more and you get better, those opportunities for malpractice really diminish. Another thing that is something you need to prepare for is the business side of the dental practice. I understand they're teaching more business in dental school, but the business side, the management side, the financial side, the handling of staff, the paying of bills, the balancing of a budget, those are all things that are not my favorite and take away from the time I do dentistry. And I would have to say that is one of my least favorite things about dentistry. If you have the right people around you, then you will be able to have them do the majority of managing or accounting and bookkeeping, and you can focus on the dentistry. But ultimately, at the end of the day, you are the one that's going to have to make the decisions that will determine how some of those answers are answered. The last thing that can be discouraging is if you have staff issues, and you will at some point. My goal is always to make my staff happy, to pay them a little bit better than everybody else, and to give them perks that make them happy to be working with you. They can work anywhere. If they want to work with you, if they are a friend of yours, if you make them feel like they are as important part of the practice as you, then that will be a great harmony. But even if you're seriously considering looking into the field of dentistry as a career, I think some of the best things you can do is to go out and find a local dental lab. See if they will give you a day or two a week to come in and observe. They will probably put you to work. The more hands-on experience you can get at any level, it will only help you. You can call your dentist, especially if he's someone you've spent a lot of time with, and ask him if you can come in one day a month to shadow his dental work. They probably won't want to give you much more than that because the patients don't want a rookie standing around. But that's a great way to get a feel as to whether or not you really even want to go into the field. The other thing I would recommend is make sure that before you make the decision, you've thought long and hard about it. It's a huge investment, not only in money, but in time. And if you get into it and you get into debt and you've decided it's not for you, in a sense, it's too late. So think about it on the front end. Put your time in, take courses that are related to the sciences, and spend time with a dental lab or a dentist, and that's going to really give you a good start as to whether or not you think it's the right field for you. If it is the right field for you, I can almost assure you, you will be a very happy person. It's a great outlet, you meet great people, and the lifestyle that it offers has a lot to say for you.